Today I'm going to talk about piercing scar, or best called fistula, produced by piercing. Fistula is a communication, in this case from the skin to a mucosa. Generally, the fistula is a communication from the skin to the mucosa. Here we can see 3 fistulas. You can see the depression. Here is a volcano, and the patient go to the surgeon, and most of them talk about a big resection, but the patient do not understand why a small scar like this, or a small fistula, must to be resected and leave a big scar. The question is, this fistula go from the skin to the mucosa, and in order to close, the surgeon not only must to remove the skin, is also need to remove this area. The skin of the labia is this, and go into deep to the mucosa when the piercing is put in the labia. Then, in order to avoid this kind of scar and help the young patient that suffer not only for an aesthetic depression in the face, this patient also suffer because all the time they are blaming that make a wrong decision. And if you leave a scar, the whole life they are blaming themselves for this bad decision. And then I studied this situation, and from my knowledge of the laser, because I'm specialized in laser treatment, I decided to use the small light of the carbon dioxide laser in order not only to burn the superficial of the fistula, just to burn deeply to the mucosa. And for this reason, I put this protection to the mucosa. You can see here, you can see the crater, and this is the way the light of the laser not only burn the superficial, that also burn the full fistula. The question is, the general surgeon or the plastic surgeon that are not familiar with this kind of procedure, they must remove the skin of the superficial area, but also they need to remove the full fistula, because if they close here in the superficial skin, they left this hole that is closed here. Then the mucosa bacteria, you have a lot of bacteria in the mucosa going inside and produce infection. This is the reason why the surgeon must to reset all this tissue. But this is avoided with this technique that I developed many years ago. And here we can see when you inject anesthesia, you also see the dippers. Here you can see. Okay, and this is the result with it, with a treatment that only lasts 10 minutes, because I use the laser light and then I close the skin. I must to liberate the superficial skin, because if I do not liberate, I can close I close is deeper. Here is a video when the patient said very happy, is in Spanish, with the result, and now is coming to perform this treatment. I hope you enjoy this presentation.